My dog is having eye issues, possibly cataracts. What can I do? So that would probably be the title for this one. Today's listener submitted question is, my dog is getting cataracts or cat or suspected cataracts, and what can I do? What are my options? That was the listener submitted question. So here we go. So very common question. We will get this a lot. My answer has changed from a few years ago to now. And then per usual, everybody will have their own opinions based on their experience and what they've seen work and not. So there's always that. So back to the question. Cloudiness in the eyes varies quite a bit in patients. Just because they have cloudiness in the eyes does not mean there is a cataract. So excluding underlying diseases like diabetes, other eye issues, we'll leave that for a different discussion. We're talking about a happy, healthy animal with no underlying disease, the cloudiness in the eyes. So once again, just because there's cloudiness doesn't always mean it's cataracts. Something else that typically geriatrics will start to develop is called nuclear sclerosis. And basically it is cloudiness in the eyes. Generally it's an older patient thing. We'll generally see it in our 8, 9-year-old patients and a little older, but all the genetics are a little different. But nuclear sclerosis is actually not too bad, and it's very different than cataracts. So cataracts, you get a lot of, we'll just say sediment for lack of a better term, in the eyes that kind of make like a scar on the eye. And you can't see through a cataract. But nuclear sclerosis, you get the cloudiness, but it's not a solid version. And there's different versions of cataracts from immature to mature. When it's an immature cataract, they can still kind of see through that, but not when it's a mature cataract. Then they can only see around the edges and not through the middle. So generally clients will start picking up on some of these clinical symptoms in low light timeframes. Generally dawn, dusk. Sometimes we'll call it moon blindness or night blindness. There's various versions. You get the general concept. But nuclear sclerosis, they get the cloudiness, but they can actually still see through it. And one of the ways that we'll do to kind of try and help us differentiate it is we'll use a light, and if we can see what's called the tapetum lucidum, so think of a deer in the headlights, you see them, they get that reflective glow, raccoons do it, dogs do it, cats do it. If you get a light on them, there's some kind of reflectiveness. It's part of the reason why prey animals, we'll say deer, cats, those are predators, can see better at night because they have a reflective film on the back of their eye that takes that little bit of moonlight, starlight, street lights for most of us because we live in cities, and reflects it back so they absorb more of that light and it reflects it better. People, we don't really have that very well, or not as much, so therefore we can't see as well at night. The trade-off is we can see more in colors in different depths and hues and colors versus rods and cones. Dogs tend to have more rods where they can see more in black and white in different depths. Humans tend to have more cones, more colors. So back to the analogy. We'll use that light. Typically nuclear sclerosis, you can see through it. You'll get that reflective film back. A lot of times they can still see through that, and given time, a lot of those will actually go away on their own. Cataracts don't tend to go away at all and actually do tend to progress with age. If you're around a ophthalmologist, they do have some really cool surgeries where they can go in and remove those cataracts. But for some people it makes sense to do, for others not. Know it exists, the option is there. So short of surgeries and specialist type things, there is a product called OcuGlow, and it's been around for a few years. I've been watching a little bit. Different ophthalmologists that I've reached out to and colleagues, manufacturer is always a little biased, but the main thing is they do believe it helps slow down the progression of cataracts depending on the cause. Like I said, it's not going to treat diabetes, but we're trying to slow down the cause or progression of the cataracts. I would word it more as like an eye supplement than a treatment, so that's a little different. I haven't been using it very long, so I don't have a lot of personal experience, but I have talked to a couple different eye specialists that do use it a lot for different situations and different things. And some of the manufacturer's claims, at least from some of the reps and the colleagues and other doctors that they had spoken to, did feel it helps slow down the progression of cataracts. So that is something that we kind of offer now that before I didn't really used to have a good alternative or even something to try and help. So that's an option, and ultimately that's kind of the best I got on that one. There might be some newer things coming out in the next few years or something I'm unaware of, but OcuGlow has kind of been the main eye supplement that has some claims to slow down the progression of eye issues. Thanks again, guys. Appreciate all the support and appreciate all your likes and subscribing. Thank you. That helps us keep going. Thanks again.